What's up, everyone? Oldine Midwife here. Today we're talking about how to choose the right hospital for your delivery, a decision that can shape your entire birth experience. It's not just about convenience, it's about finding a place that matches your birth plan, values, and health needs. I'll give you the essential questions to ask so you can make an informed, confident choice. Remember, being proactive isn't being difficult. It's being smart about your care. Grab a notebook or get ready to screenshot. This checklist will help you navigate hospital tours and conversations with your care team. By the end, you'll feel prepared to choose a hospital that supports you every step of the way. Let's dive in. First up, what's your hospital's C-section rate for first-time low-risk pregnancies? This number reveals a lot about a hospital's approach. Do they support natural labor or are they quick to intervene? Ask specifically for the NTSV C-section rate. That's for first-time moms, full-term single baby, head down. A low NTSV rate usually means the hospital supports laboring mothers with patience and various techniques to avoid surgery. A high rate could be a red flag for unnecessary interventions. Remember, C-sections are sometimes necessary, but you want it to be a medical decision, not just routine. Ask if they support VBACs, vaginal birth after cesarean, if that's relevant to you. Hospitals open to VBACs are often more patient-centered. Don't settle for vague answers. Ask for specifics and context. If they're defensive or can't provide data, that's a sign about their transparency. The goal isn't zero C-sections, but appropriate, evidence-based use. This question sets the tone for your entire birth experience. It helps you find a hospital whose philosophy matches your own. Open communication is key. Look for a hospital that welcomes your questions. Your birth plan matters, but the environment can make all the difference. Choose a hospital that aligns with your goals to reduce stress and focus on what matters most. Welcoming your baby. Don't be afraid to ask follow-ups about their approach to interventions. The right hospital will see you as a partner in your care. This single question can reveal their protocols, attitudes, and commitment to patient-centered birth. Make it your starting point. Next, ask, do you have wireless, waterproof fetal monitors? Traditional monitors keep you tethered to the bed, limiting movement and comfort. Wireless monitors let you walk, use the shower, or change positions. Crucial for pain management and labor progress. Movement helps labor progress and reduces pain. Being stuck in bed can slow things down and increase interventions. Wireless monitors use Bluetooth to send data to the nurses, so you're free to move while staying safe. Ask if they're waterproof. Hydrotherapy, showers, or tubs can be a huge relief during labor. If they don't have enough wireless monitors, ask how they support mobility for patients who need continuous monitoring. Intermittent monitoring with a handheld Doppler is another option for low-risk patients. The hospital's answer tells you a lot about their philosophy. Do they support active mobile labor? Freedom to move isn't just about comfort, it's about better outcomes. Feeling in control and able to move can make your birth experience more positive. Don't underestimate the psychological benefits of mobility. If you want to use water for pain relief, make sure the monitors can handle it. This question is a shortcut to understanding how much the hospital values your comfort and autonomy. The right tools can make a huge difference in your labor. Ask and don't settle for less. Your comfort and progress matter. Ask, do you provide birthing balls and peanut balls, and are nurses trained to use them? Birthing balls help you stay upright, move, and relieve pressure. Great for pain management and labor progress. Peanut balls are especially helpful if you're in bed, like after an epidural. They open the pelvis and can shorten labor. These aren't just trendy props. They're evidence-based tools that support your body's natural process. It's not enough for the hospital to have them. Staff should know how to use them effectively. A knowledgeable nurse can suggest positions and help you use these tools for comfort and progress. If the hospital doesn't provide them, ask if you can bring your own. Their policy tells you a lot about their openness to different comfort measures. Hospitals that encourage these tools are usually more supportive of a variety of birthing positions and pain management options. These simple tools can make a big difference, whether you want an unmedicated birth or plan to use an epidural. Ask about their availability and staff training. It's a quick way to gauge the hospital's commitment to hands-on labor support. The right support tools can empower you to work with your body, not against it. Don't overlook these questions. They're small details with big impact. Your comfort and progress are worth advocating for. The right environment will have both the tools and the expertise to help you succeed. Make sure your hospital is ready to support you. If you're considering an epidural, ask, is anesthesia available 24/7 and who provides it? An anesthesiologist or a CRNA? Are they in-house? Anesthesiologists are doctors. CRNAs are advanced practice nurses. Both are qualified, but in-house coverage is key. In-house means the provider is physically present, not just on call. If you want an epidural at 3 a.m., you don't want to wait for someone to drive in. Delays can mean more pain, missed opportunities, or even complications if you need an emergency C-section. Ask for specifics. Are they physically in the building at all times or just on call? Don't accept vague answers. Clarity here is crucial for your comfort and safety. Immediate access to anesthesia is not just about pain relief. It's a serious safety issue. In emergencies, every minute counts. Knowing you have expert care on hand provides peace of mind. Whether you're sure about an epidural or just want the option, this info matters. The right hospital will be transparent about their coverage. Your health and your baby's health depend on timely, expert care. Don't hesitate to ask for details. This is your birth. Make sure you have the support you need when you need it. The right answer here can make all the difference. Be direct and get the facts. Ask, is your hospital baby-friendly? And what does that mean for my stay? Baby-friendly is a formal designation from WHO and UNICEF for hospitals that support breastfeeding and mother-baby bonding. It means immediate skin-to-skin contact after birth and keeping your baby in your room 24/7. These practices help with bonding, breastfeeding, and confidence as a new parent. Baby-friendly hospitals avoid formula and pacifiers unless medically necessary, supporting your feeding goals. They also provide education and support for both breastfeeding and formula feeding moms. Even if a hospital isn't officially designated, ask about their policies on skin-to-skin, rooming in, and lactation support. The designation is a strong indicator of a supportive environment, but specific practices matter most. This question helps you understand the hospital's default approach to newborn care. The right environment can make a lasting difference for you and your baby. Choose a hospital that honors this special time. Your first days together matter. Next, ask, do you have International Board Certified Lactation Consultants, IBCLCs, on staff, and are they available day and night? IBCLCs are the gold standard for breastfeeding support. They handle everything from latch issues to low supply. Having them on staff shows the hospital is serious about helping you succeed. Ask about their availability. Babies don't follow a 9-to-5 schedule, and you might need help at 2 a.m. If there's no 24/7 coverage, ask what support is available after hours, trained nurses, a hotline, or other resources. Early breastfeeding can be tough, and expert help can make all the difference. This support isn't just for first-time moms. Every baby is different, and challenges can arise anytime. IBCLCs provide both practical help and emotional support, boosting your confidence and troubleshooting problems. Ask if you can meet a lactation consultant during your tour to get a feel for their approach. Don't be shy. Breastfeeding is a learned skill, and the right support is critical. Knowing help is available can reduce anxiety and set you up for success. The hospital's answer will tell you how much they value postpartum support. This is the final piece in building a supportive birth and postpartum environment. From C-section rates to lactation help, each question gives you a clearer picture of what to expect. You deserve a team that supports your goals. Make sure you'll have access to expert help when you need it most. Your breastfeeding journey starts in the hospital. Set yourself up for success. Ask and be confident in your choice. There you have it. 6 essential questions to help you truly understand what a hospital offers. Take this list on your tours and don't hesitate to ask tough questions. You're your own best advocate. Preparation reduces anxiety and builds confidence for your birth experience. When you choose a hospital that aligns with your values, you'll feel empowered and in control. Focus on what matters most. Welcoming your baby into the world. Thanks for watching. If you found this helpful, subscribe, Defobina, and stay tuned for more health tips. Stay informed and be well.